We're still waiting for just a few people to join, but I wanted to go ahead and get everybody in. And if you've joined us before, you know we've had a few technical difficulties and we couldn't get people to be able to hear their microphone or see their faces. So if you have the ability to show your video and you're comfortable, we would love that. And as we're waiting for everybody to join, we would love if you would put in comments 3 things: what state you're from, what kind of setting you're in, hospital, ambulatory, or community, and then is this your first time with us? There we go. I was about to say, can I be heard? But yes, I can. Yay, Canada. Tennessee first. Wonderful. Now, don't forget to tell me if you've been with us before. Austin. Great. Baltimore. Virginia. Great. All right, so for those of you who have just joined, we have asked in the comments if you could please put what state or country you're in, and whether or not you work in the hospital, ambulatory, or community setting. And then I would love to know if this is your first time with us or not. So this is our 3rd time presenting this out to our child life specialist peers. And we're very excited to be able to do this. If you missed the introduction, I am Dee Dee Fritch. I am the founder of Hearts Connected. I'll give you just a little bit about me, and then we'll talk about Hearts Connected briefly, and then I'll turn it over to our speakers. So I am a pediatric nurse of 30-something odd years, have lost track, worked at Children's Healthcare of Atlanta almost all of those years, and I now have a healthcare consulting firm, and then started Hearts Connected a little over a year ago. So I have a huge passion for child life specialty and also for how technology impacts the care of kids. So we are all across the United States. We're a virtual community-based child life specialist practice. I have about 5 contracted child life specialists that work with us, and we've got some really exciting things coming up. So please, if you're not following us on Facebook, LinkedIn, Instagram, do take a look at our website. We've got a lot of cool things on our website, and a section just for professionals, and that gives you some additional information to check in over time as well. So let me see some of these other messages. Baltimore, Maryland, community, first time. Child Life United, great. California, community-based, good. Don't see a whole lot of that. Steph, you're community-based too, great. Nebraska. Morgan in Atlanta, I'm in Atlanta too, yay. All right. Montreal, Cleveland, lots of Canada. Great. All right. So if Molly, if you can, or Alice, kind of switch to the next slide, and I'll talk just for a minute about child life specialists. So, I mean, not child life specialists, but Hearts Connected. So I mentioned we're across the United States. We're virtual. We have contracted child life specialists that work with us. They almost all have other jobs, right? And they work with us to provide virtual care throughout the United States. We've got several programs that we do as well. And I'm not going to go into all of that today, but I did want to point out that we have a way to where you can make a referral to us. And I wanted to talk about that specifically because I'm passionate about it. So when you think of transition of care between the hospital and community, or community to hospital, whichever way you're going, right now, most of you, unless you're lucky enough to have a community-based child life specialist in your area, you don't have anybody to refer to. So I just kind of wanted to remind you that we're here and we would love for you to refer to us. And if you document in your medical record that you referred to us, and the parent, when they fill out their online forms, they can give consent to share back, and we will send encrypted emails with the visit information back to you, so that when that child does come back into your setting, you know what happened in the community and with us. So we would love for you to kind of help us support that transition of care that we don't always have in every community. So all right, so I'm going to do a couple quick introductions. One, I just wanted to introduce Alice. She is our operations manager. So she is here. She won't be speaking today, but she is here and kind of helping us in the background. And then Molly Wilson will be the one facilitating today, and I'll let her take over and do the rest of the introductions. So again, thank you so much for joining. I'm not leaving, but I'm going to be on the back.
Thanks so much, Evie. Awesome. Well, thank you guys all for joining us, and thank you so much to our panelists that are helping, promote this conversation today. We started the Prioritizing the Me in Mental Health series back on World Mental Health Day in May, and so kind of started the conversation then, and really took it to focus on a professional level. And so recognizing, we've done a couple of these, but recognizing that students are a huge part of our profession, and a big topic at the moment, and something that, has been discussed. We've all been in this boat. We've all, been a student, and kind of talking about how we're supporting them, and then how we're supporting, supervisors and each other, and what does that look like? So really wanted to just have more of a conversation surrounding that as we continue this series. So we today have our panelists joining us, which thank you all so much. I'm so grateful to each of you. I'm going to go based on my screen, just because that's what's showing up, and introduce our panelists. So if you guys will just share a little bit about yourself, that would be awesome. First up on my screen is Kerry Harper.
Hi, I'm Kerry. I work for Children's Healthcare of Atlanta. I've been there for about 4 years, and I just recently transitioned to a PRN role because I am fortunate enough to have 2 little babies at home. So just wanted to get a little bit of extra time with them before they're too grown. But before my transition to PRN, I worked primarily with GI, endocrine, and the eating disorder population. And I was in that role for the entire 4 years, essentially, that I've been at CHOA. And then before my time at CHOA, I worked for Texas Children's, but at a community hospital, kind of on their behalf. And then I worked at Nationwide Children's for about a year. So I've had the opportunity to kind of get to see how different programs are run. And I'm thankful for each of the experiences that I've been able to have.
Awesome. Thanks so much, Kerry. Next up on my screen is Sophie.
Hi, my name is Sophie. I am a certified child life specialist. I am currently working in community-based practice. So I recently started my own practice called Ready, Set, Cope. I'm in the Boston metro area. Previously, I was a hospital-based child life specialist for about 5-6 years in New York City. I was in the emergency department as well as multiple different surgical departments. And I'm very excited to be here. Part of what I do too now in the community-based setting is I was lucky enough to become involved with Child Life United and their virtual practicum. And so that will be some of the experience that I'm speaking to today. So thanks for having me.
Awesome. Thank you so much, Sophie. Next up, I have Caitlin.
Hi, everyone. My name is Caitlin. I started my child life career in Phoenix Children's Hospital. I worked in the inpatient HEMAC world there for about 3 years. And then I moved overseas, and I'm one of the specialists that started the child life program in Doha, Qatar in the Middle East. and I started I activated the complex gen peds unit, and I activated the nephrology unit and the dialysis clinic outpatient. And then I transitioned back to HEMAC and worked in the outpatient HEMAC clinic as well as our outpatient infusion clinic. And then I moved back to America recently, and now I am working inpatient with a variety of different subspecialties in Hawaii.
Awesome. Thank you so much. And last but not least, Kerry Harper.
Hi, everybody. I'm Kara. I have been in the field for about 14 years now. I started in fellowship at Cincinnati Children's and their ICUs. And then for the past 13 years, I've been the PICU Child Life Specialist at Inova Children's Hospital. We're in Virginia, right outside of Washington, D.C. And recently I transitioned to our ICU clinical lead role. And as part of that, I am a resource to all of our ICUs. So I'm still in the PICU, but also helping in NICU, the cardiac ICU, and our specialist who works with children and adult patients. I have some certifications in trauma, in crisis intervention, and I'm also a compassion fatigue specialist as well.
Awesome. Thank you guys so much. Your backgrounds are invaluable, and I think speak to a huge variety of things. So I look forward to this. We're going to kind of jump in first and ask everybody to join us. I'm going to launch a poll real quick, just talking logistics so that everybody kind of knows what's going on in everybody's world. And I recognize that this looks different for everybody, especially in light of a pandemic. So if you will share with us a little bit about yourselves, and let me know if that doesn't launch. But we'll give everybody just a few minutes to share kind of your supervision, where you're at currently, and your role. That would be awesome. And then I will ask our panelists if you guys will share with us what, if you are currently supervising, or just kind of your supervision experience, and what that looks like currently for your department. And I will start with my screen change. So I'll start with Kara.
So in our department just recently transitioned to our pod system. So we've been going through some department structural changes, but even in my role now, I have had a student. I've been a supervisor to a student. And so because I'm not, as a lead, I'm not tied to a unit. When I have a student, we are collaborating with the specialists that are on the units and just sort of taking more like a consult basis, having patients from each of the ICUs, where then we would come in and take the primary role as a child life specialist there. Molly, what was the rest of the question?
That was perfect. Asking, what it looks like for your department. Are you guys taking multiple interns? Has anything been impacted due to COVID?
We're still taking 2 interns, which was the same before the pandemic. Sometimes our students who are affiliated with a university, some of them have come with certain restrictions as far as what types of patients they can work with. For example, one of our students could not see COVID patients. So we've just worked around that the best we can. We take up to 2 students. We've never done more than 2.
Next up, Kerry.
So I think the biggest thing that, the biggest way that COVID has impacted our student program at CHOA is that during the height of the first wave, when there was a shortage of PPE, we weren't able to take students at that point, just to try to minimize contacts and to conserve our PPE within the hospital setting. But since that has kind of passed, we have been able to have students back in the hospital, and I think we've got a couple of interns finishing up now. And then we are taking a break for the spring semester, but that is more just for a chance for our staff to kind of recalibrate and breathe. We'll be still taking practicum students during that time. But in terms of whether or not students are able to see COVID patients, it's just been a requirement now that all interns are fit tested for N95s, and then making sure that we're giving them the most appropriate and the best like protective equipment to be able to do their jobs effectively and to learn, what that looks like. And so, it changes a little bit depending on which department you're in and which population you're working with as to like how much exposure you're getting to that or how often you're having to get that PPE. But that's probably the biggest impact that COVID has had on our like student program.
Yeah, definitely. We've seen and heard on the curious to everybody else, it does vary. Greatly. So, Caitlin, how do you think?
So I have had practicum students, intern students, and fellows with me at one point or another, both overseas and in the US. And I think that thankfully interns and students at large, we haven't seen an impact in regards to like not having an internship or offering that ability for students to join in on the team. I think mostly, like other specialists have been saying, the impact has been surrounding like the fit testing for N95 mask. Like I know our previous students were not able to see COVID patients because they were not able to get fit tested, so they couldn't have the proper PPE. And then in regards to their ability to kind of see and experience sibling support, our hospitals haven't been allowing, there's been a lot of restrictions around visitors, especially siblings that haven't been able to be here. So just like we as specialists and professionals have adapted to this COVID time of probably doing a lot more support with siblings through like things like Zoom and things of that nature, through video chatting, the students have also done things like that as well.
Yeah, absolutely. I think that, everybody's kind of adjusting as they can and on the fly, and, what was protocol and might have been something in place on Monday, by Friday, that could look different.
Exactly.
So I think that's
and it's a good learning experience for the students to experience what we all experience, right? Like this is the real life work, and this is how we acclimate and accommodate and adjust on the fly.
Absolutely. And then Sophie, if you'll just share a little bit about how you guys are supporting and working with students during the pandemic.
Yeah, so currently right now in this cohort, all the clinical supervisors for Child Life United have 3 students each. I was fortunate enough to be able to do the last cohort as well during the summer. And I think kind of what is so creative and wonderful about this program is that it was really in response to the pandemic. And so we were, especially in a COVID world, being able to offer a virtual practicum space for students is offering really accessibility in the field. And, I think regardless of COVID, it's also for those students that are, working full time, have families, maybe unable to relocate. I think it's an opportunity for accessibility for that as well, and kind of eliminate some of those challenges and stresses, therefore also meeting some self-care needs, which I know that we are going to talk about. But yes, I have 3 students right now and have had 3 students in the past in a virtual space, and also have had some experience as a hospital-based child life specialist on our internship committee, as well as overseeing students as well.
Thank you. Well, we are going to kind of jump in and talk. So it's not to negate, there are lots and lots of things that we could talk about related to students. We could definitely run over our hour very quickly. So we're going to kind of focus on the mental health piece, but please feel free. And also from an audience standpoint, even if you are not a part of the panel, we'd love if you have anything or you'd like to ask questions, feel free to chime in at any point as well. All right, so what things are, and this is just, I'll let the panelists just kind of jump in as they feel led. So what things are in place to help with self-care for your interns or students regarding mental health while they're interning or doing a practicum or clinical hours, whatever that might look like? I know, there's a lot of things set forward, guidelines set forward from an internship standpoint, but this isn't addressed in the same way. So we'd love to hear what other facilities are doing.
So I can speak to what we have done in the past. We have an educator who's over our internship and student like practicum, all of the students. And typically supervisors get to meet with the educator pretty regularly, once a week, maybe once every other week, depending on how things are going and what the needs are, as a chance to just kind of like debrief and make sure that the supervisors are getting the supports that they need and having a safe space to kind of process through all the different things that are going on. And then for our students, they have a Friday wrap up is what we call it, but it's essentially half of their day on Friday is spent with the educator and with the other students to have some opportunities for additional like education and learning, but also a chance to, again, like process what's going on and what they've been exposed to and what they've seen, to make sure that they're getting the supports that they need as well.
Yeah, I can definitely echo that. I think in our virtual practicum space, there are opportunities for both individual supervision and group supervision with the three other or the two other students in that group, as well as a debrief time that kind of allows for processing, allows for reflection, and allows that connection piece to the other students in the program as well. And I think too, Child Life United really offers speakers that can speak to their own self-care practices as well, which I think can be really valuable and insightful for students.
I think to echo what the other folks were saying, a lot of processing and debriefing, both in-person meetings, but also a lot through journaling and what we specifically prompt our students to journal about and reflect on. And then the follow-up questions that we're asking them, so that they're thinking about these things and that they're aware of different parts of their practice from a mental health perspective. I think important too is modeling that behavior for our students as well. So not just talking about it, but the more that we model it, let's say something as seemingly simple as leaving on time, right? We know how hard that can be sometimes. But if we're talking about it, but then we're not doing it ourselves, it's easy for students to just see what we do and follow that. But we want to model that appropriate boundary and doing those things for our own mental health, like trying to leave on time as best as we can, as often as we can, and things like that. So talking about it, but then doing it and having our students see that so that they know that they should and can be doing that too, and that that's okay. I think that's really important.
And similar here at Inova, we have a scheduled weekly meeting for the students together to meet with the internship coordinator, and then each week time to set aside with their unit rotation supervisor as well. And they do get one in-service that's dedicated to self-care.
And that's a good, I think, kind of facilitating that conversation. Really, I think it's interesting sometimes to hear what's formally put in place can kind of provoke conversation versus it's naturally. And I think sometimes that conversation can vary depending upon how comfortable the individual, who is fostering or facilitating these meetings with students, how comfortable they are with having that conversation. I know that, over the years with the interns that I've worked with, as well as most previously I worked with for Children's Healthcare of Atlanta and did have experience with our interns, and we had a couple of different formats over the years, but I've always had what they refer to as Friday wrap up that Kerry described. And so, but prior to having an educator, it was facilitated by the supervisor. At one point, we pulled in staff members, and so it was a rotating basis. So you definitely, what you experience as a student varied depending upon the individual, and that definitely can change that dynamic a little bit. If your supervisor comes down because it's their assigned week, does that conversation flow as naturally, or promote that conversation? So it can definitely fluctuate. So I think that that's an interesting thing. One of the questions that's come up with supervising students, and I feel like I've seen this out there in the social media world as a question, is within your facilities, are lunch times or meal times during the ED, I recognize that may not be lunch, are your supervisors and interns eating together? That has been something that I've seen a lot kind of flutter around recently in regards to mental health, and what does that look
I think across the board at all of the hospitals I've worked at, the option has been there, and we've kind of just left it up to the student to decide what they're comfortable with. but we have always done a pretty good job at the different facilities about, lunchtime not being a place where we're talking about work or talking about the internship or whatever it might be, and that we're really just talking about things unrelated. So it makes it a different kind of space and environment for students to be welcome to. So we've mostly just left it up to them. I've seen it go both ways. I've seen it where students have joined. I've seen it where students haven't joined, and we've totally made it a personal preference, whatever they choose.
Similarly, for us, it's been kind of dependent on the supervisors and the students, and it changes often, but we try to, again, like reserve that lunchtime break for a chance to not just like have a break from your clinical work, but also from like the mental strain of all of that as well. And so just trying to encourage that to be a time of either just socializing with your coworkers or taking some time by yourself if you need it. But I would say more times than not, we have the students and the supervisors eat separately, not as a way, like not in any like you can't sit with us kind of way, but just as like, let's reserve this safe space for both of us, and making sure that, we're giving each other the time that is needed to be able to kind of process through what's going on and cope with the rest of the day and the rest of the week. But again, that changes so frequently based off of like the supervisor's preference and the student's preference, and also the area too. Like it's never the goal to isolate a student and make them sit alone by themselves for lunch. And so if there's only one student, then it's going to be a lot more inclusive and important for them to, feel like they've got that support system as well. And, similarly, like if a student's working in the ER and their shift is, later in the evening when there's no other students or no other child life specialists, in the building, then they're more likely to eat with their supervisor in that situation as well. So all that to say, it is so dependent on the person and the department and just kind of what the individual needs are.
Here for us, it wasn't until pretty recently that we had the conversation as a department that we don't have to have our student with us constantly, which for a lot of us was a relief. So just recently, we began to entertain the idea that if you feel like having lunch apart from your student is what you need, that's encouraged. And I would say most of the time that's the direction our supervisors have gone in, but we've also found that since we do take 2 students a semester, that was really time where the 2 students could have another point of connection, be together for part of the day and have a break from us as well. But prior to recently, they were with us all the time. They ate lunch with us all the time.
And that can be a lot. And one of the things, I had a student a few years ago, she brought up the conversation, and it had nothing to do with, her taking a break from myself as a supervisor. She really was very keen on the fact that a lot of people come to lunch as other specialists and share their day, what's going on, my crazy patient, this PIC line that went awry. And she really found that it had nothing to do with our dynamic. But from a self-care standpoint, she was like, I'm absorbing as much information as I can. I'm working so hard to learn in this environment, and I'm getting a very one-sided filtered version of things that are happening, and that's constant. So and she was like, basically, unless I go to the bathroom alone, I felt like I was always hearing, it wasn't that anybody was being, negative or anything like that. It's a normal reaction to come to the table and let somebody say, how's your day going? Very common question. And to get the reaction of like, let me tell you about this PIC line. And then realize that she was like, I was having to I'm trying to learn about this PIC line. I haven't had this PIC line experience. And then I'm suddenly worried that that's going to be my PIC line experience. And I don't know what to do because I'm not processing this. And really talked about how lunch, not so much from the supervisor dynamic, because we would stop having that dialogue, but to have everybody else, especially we're a larger department. So lunch can be anything from 8 people to 15, 20. So when you're suddenly growing in that capacity, it can be a lot to take in. So a lot for, just to be mindful of as students are. And if anybody in the audience cares to share, definitely share with us. If you have a practice, I feel like have gone through so many practices on lunch. I feel like it was a topic of staff meeting conversation once a quarter. We would go round and round. It was that they always came to lunch, that we picked days they came to lunch, that they never came to. It was always a conversation. So I think it definitely provides an interesting topic, but anybody feel free to share. And we'll kind of segue into talking. So definitely focusing anything else from a student mental health standpoint, as far as interventions, things that you guys have in place beyond what's been shared that anybody wants to share or discuss. And if not, we'll kind of move into the second section. All right, so support for the supervisor. And I'll kind of take the chat box as well. So I know that Michelle just shared, so we were struggling with this in the past. We only had one intern, and due to COVID, we were supposed to eat alone. So it had been an issue with a couple of interns, and I can see that. I can see there are so many sides to this. Who knew that like lunch just would be such a hot topic? And I feel like for our department, it was once a quarter, it was a hot topic. We tried something new and that didn't work for everybody. And so how do you meet the needs of students and have that conversation? And definitely when you are a single intern, and I can speak to that experience, I was the only intern at my intern practice. And to be honest, they were very inclusive of me. I, was included in lunch. I was included in kind of whatever that looked like. I never felt like I couldn't step away. I don't felt like we had necessarily a completely dedicated time that we ate lunch. It was more of, I would sit down. Occasionally I had one supervisor that she would kind of insist that I got lunch, and she would maybe tie something up if it needed to be done. So I think it varies for everybody, and it can be hard when you have one intern. And, how do you make this a welcoming experience while also trying to help them understand the boundary piece and also supporting where they're at, just from a social standpoint of like, it can be lonely to be sent away to lunch, what does that feel like? So it's definitely a big conversation. And I can definitely tell that we're not the only ones having. So as far as support for the supervisor, what does self-care when you guys are supervising? What does self-care look like for you? Caitlin, I think you did an awesome job of kind of starting that conversation and highlighting, the boundaries piece. So what does that look like when you are supervising students? Are there, what are the things that work for you?
I think for me, allowing certain hours to be for the practicum, review of assignments, answering emails, all the things that come along with being a supervisor, allowing certain hours of my day. And I know that might look different because I am community-based, but allowing certain hours to be for the practicum, and then having a boundary for myself of, these are not the hours of the day that I'm going to utilize for the practicum. And then I think too, we are offered an hour each week to debrief with the other supervisors, and to kind of use that space as our own reflection, and to use that space as like, hey, this didn't go so well. What would you guys do in this situation? And just find that connection with the people that are doing the same thing that you are in that space. So I have found that incredibly helpful as well.
Yeah, I would echo all of the exact things. That would have been my answer too. I think the only thing I would add to that too is prior to a student onboarding, I think it's important that if, unless of course you're a one-person program, but if you have a team, I think it's important to discuss as a team, and everyone kind of talking about like their expectations, their boundaries, like what they need, and being transparent and what they need from each other during that time, because it's a lot of additional responsibilities and roles that you have, and your time is allotted differently. And I think it's important to discuss with your supervisor or manager, whomever leads the team, kind of their expectations around your working hours and what's expected of you during that time, and kind of how the roles might change. And then you being clear and transparent with your management team, what you can take on and what you're comfortable with, and just having those transparent, open conversations ahead of time, so that there's nothing in the gray area or nothing that isn't really clear, and just making sure that everyone feels supported and has what they need, not only for the students, but for the supervisors and the team at large. Because we know that when a student is with you during a rotation, it kind of, especially if you have a smaller team, I've noticed that it can pull and it can change the whole team, because people have to kind of pick up some things for other people on the team, and you just really have to work together to get everything accomplished. And it's good to have those conversations prior, I think.
One thing we recently changed for our program is, while we typically take students for the summer session and the fall session, and then we don't have students in the winter to allow everyone to have a break, but we divided the department into 2 groups for supervision. So half the department are eligible supervisors for the summer, the other half are eligible for the fall, and that's helped to alleviate people having back-to-back students, which has made a big difference for people.
I like that a lot, because I think that I've heard that many times. We lived that very much of, it was almost one of those that there was a little bit of, I'm not busy enough, and so students are going to fall in my lap kind of thing. And there were certain units that I think naturally appeared more available, even if that wasn't the case, for student supervision. So that's a really cool idea. I think that's super easy to implement. Might have to be flexible with it depending upon life events, but I think that's a really great idea. Is there anybody else who has anything within your department regarding supervision that's kind of in place to support and kind of manage those pieces? And then as far as audience goes, if you guys have anything as well, we'd love to hear what other programs are doing.
I feel like it's constantly evolving for us, like trying to figure out what is the best way to support supervisors, and kind of going through like a period of trial and error to try to see okay, what is working, what isn't working. And I love that it's become such a big focus to try to make sure that everybody's supported. And, this is obviously such a big conversation, and I love that it's being had. And, I think, just to echo everything that everybody else has said, just making sure that you have those crucial conversations with your team, and that you've got your group to support you kind of throughout the process, whether it's your colleagues or maybe it's your intern cohort, or whoever it is, your people, to be able to process through the different challenges with in a safe place, and with a group that's gonna keep you accountable to not just say, oh, I need to take care of myself, but also to be okay, so what are you doing to do that? And kind of figuring that out together, and making sure that that you're following through on what you say you're going to do, I guess.
And Grace shared it as a 1-person program. We did 4 days a week for the first half of the session, 12 hours of what's the help time, catch up on other tasks, which I think is huge. I think prioritizing, recognizing within your program, if you are a program of 47 child life specialists, that's not to say that your patient volume isn't that much higher, but there are more hands and more people available. When you get to being a smaller program, which is an amazing internship experience, it does get harder, because you are then, as child life specialists, we're all wearing many hats, but you are wearing all the hats, and they're all your hats. And there's nobody to hand the other hats to, which makes things even harder. And definitely, is there the opportunity? I know one of the things that I did during my internship that I found was helpful was my supervisor, when she had something going on that was specific to herself. It would be not necessarily that I went and shadowed another child life specialist, but I went and shadowed different disciplines that she frequently worked with. And that was one way that, it just kind of naturally, I learned a ton from that. I got to hear their role. I got to have a different perspective from the healthcare side of things. And it also then allowed her to step away and not place that kind of immediate need on another supervisor. I joined many other child life specialists throughout my time, but if there was the opportunity was available, it was a great experience. Actually, to the point that one of the case managers, the clinical case managers, and I have kept in touch this many years later, because I found her experience to be so valuable, and my time with her, and she could really reflect on things and learned a ton from her. So I do think that there's always that if staff are willing, it's a great opportunity to kind of use that outlet too. So thinking just kind of within your own practice and within your own departments, kind of continuing the conversation of mental health. How do you feel like self-care is prioritized just within your departments? Is it outside of the internship? Is it something that is a focus right now? You know, I know that we can probably all identify a few self-care webinars that have been at least offered to us over the past 18 to 20 months. But what does that look like within your department? Does that conversation continue? Is it something that is supported, and what does that feel like for your department?
So I had mentioned before that we had recently restructured to more of a pod-based system. And part of what was built, the new structure, was to help address some of the stressors that people were having continuously. So in our department, it was a lot of, I feel like I have to do my job plus somebody else's job, cross-covering too frequently. I feel guilty taking a day off and using my PTO because it adds burden to other people. I feel like when I have really difficult cases or situations that everyone else is so busy that I have no one to help me. And so with our restructure and part of our pod system, each pod, our inpatient, outpatient, and ICU, has a lead that sort of fills in those holes, so that when people are out, there's less cross covering. When people take PTO, they know that their entire job isn't being dumped on someone who also has an entire unit to manage, and that anyone who has a really difficult case or feels like they need help, there is that lead as a resource that's already built in to like establish that culture that it's okay to ask for help and someone's available to help you. You're not adding burden. And so a lot of times, especially with difficult bereavement situations, in our ICU pod, no one's really doing that alone. And that looks different for everybody as far as how much support they would need or what they want that to look like. But that's been a huge relief, I would say, for our specialists. And then we also do a monthly resilience group where students are not a part of that. So it is a space away for supervisors, but each month we have an intentional space to connect with each other. And I coordinate like different speakers or people to come in that address self-care and resilience related topics. So we try to do that each month.
That's really cool, Kara. I love the idea of, having those different programs kind of like implemented once a month to make sure that everybody's really taking care of themselves and the department as a whole. I think that's awesome. Another avenue we have for self-care and just like a place to support the supervisors is through like our reflective practice model that we started a couple years ago. And so just having those intentional smaller group meetings to be able to process through different cases, whether it's with a student or without a student, but just helping to make sure that our specialists are feeling supported in that smaller setting as well.
Kerry, I have a question about that. If you have a hard case, do you have the ability to kind of raise a flag and say, hey, I need a debrief or I need a break? Or is that only, are you doing that only during a set time?
No, I think so. I think one of the strengths of our department is that we really like to help each other. And so we definitely have those set times where we get to talk about those cases. But I think that it is also practice to be able to wave that flag if you need to. And we communicate through like our Volt phones at work. And so oftentimes you'll get a text from one of your coworkers that just says like, hey, I need to step away for 5 minutes. Can you cover? And that's an easy thing to be able to log into their unit for them and field any calls so that they can step away and take a break. or like being able to go to your team lead or maybe one of the other like senior specialists on the team to be able to say like, hey, this happened, like, what would you do? Like, how would I respond to this differently? It's certainly nice to have that organized time to process it, but it is definitely something that we do like on the fly as well. Does that answer your question?
Yeah, it does.
Good.
And I think to piggyback off of that, Kerry, Cuddle also served a little bit of that. So our department does Cuddle once a day. The times move. Right now it's a little before lunch. But basically it's meant to be, less than 10 minutes of your day, but it's a place to come kind of share. You don't share specifics, but you do kind of highlight what you're focusing on. And also kind of highlight, so I, before going PRN at CHOA, was in the ICU. And so one of the things was like how many bereavements I had going on, things that kind of were big things that it would help so that somebody like Kerry many times would be like, if you need help with your 4 bereavements, like maybe rave, like I'm over here and, we can tag team. And so I felt like that was also a huge thing that was put into place. And it changed many times and it definitely fluctuated, but I felt like it is there. And it's also, even if you don't come and share those things, you are laying eyes on your peers, which sometimes, nonverbal communication is key on those things. So I did feel like that was a really great outlet as well.
Yeah, and I think, oh, sorry. I was just gonna say, and I think it also like just encouraged people to feel better about asking for help, because that's not an easy thing. Like when you've got a field full of helpers, it's hard to be the one that asks for help, even though everybody's there because they want to help. And so like giving people the space to say like, hey, I've got this many patients and this many procedures, like I know that I can't get to X, Y, or Z. Does anybody have flexibility in their day to be able to help with that? Just like feeling comfortable and confident to have that conversation, I think changed the game for us for sure.
And I would agree. I was a lead in part of my time there. And so it also allowed me insight of knowing others. And when I would come, because I was also clinical and to participate, I felt like that was a great opportunity too for people to highlight what's really happening towards leadership, so that leadership had eyes, on what was going on and could be aware. And I felt like it was a really quick way and a snapshot, but to share a lot of meaningful communication and to support staff. Absolutely. Alice shared that. Sorry, go ahead.
Something that our team does too, it's a little bit different, is we utilize the Clifton Strengths Survey. And it's been really helpful for self-care and also to get to know each other from a personal standpoint, but from a working standpoint. And it has allowed us to see our own strengths as individuals and as employees. And we meet every month to kind of discuss our strengths and like what does that really mean. Like for example, like discipline is one of my strengths, and like when I think of the word discipline versus what it kind of really elaborated on was very different. And being able to kind of discuss as a team these strengths and what that can look like and how it can showcase or not in our work. For example, it's allowed us to be able to know who to go for in our team for certain things. So for example, if a pretty end of chemo poster needs to be made, like my team knows, don't go to Caitlin because she's not creative, right? Like Caitlin's not going to make this beautiful poster. But Caitlin has a strength in, let's say, presenting. So go to her for that. So then it allows your teammates to lean on you and go to you for things that fill your bucket and help fuel you, which helps, of course, the longevity in the field and your just happiness at work and your satisfaction, right? And it's also been helpful as you are a supervisor within an internship program, knowing when you have a student, like what your colleagues' strengths are and what they're going to focus on with that student versus what you're going to be focusing on based on those Gallup survey strengths that you've discussed as a team and that you know about with each other. I think it's been a really helpful addition to kind of that self-care model and understanding one another and understanding yourself more.
Yeah, Caitlin, that actually reminded me of something we did at my previous hospital. As one of our retreats, we did kind of like a Myers-Briggs type personality assessment of the people on the team, and specifically your coworkers that you work directly with. And I think part of that was understanding yourself, but part of that was also understanding how your personality and your traits kind of integrate with the person that you're working directly with. And I think that it was so valuable in learning, how can I best communicate with you? What are some of our strengths and how do they match with each other? So I think that was something really cool we did. My previous hospital also established a unit council, which was really kind of 5 representatives or champions of the team that were really the voice of the child life team. And so we were able to address concerns and questions from the child life team as a whole. And that was kind of like a committee that was able to focus solely on that together. And so we addressed a lot of concerns about coverage, about, some of the other concerns that the other panelists brought up. So I think that was really valuable, and also spoke to the strengths of the people on that unit council, because they maybe had strength in, that organization or that kind of more administrative task.
Molly, you're going to shoot me. I'm just going to add one more thing. I love that y'all are bringing up things about talking about positives, because where, we all need a way to debrief and we need a way to vent. If that's the only space we make, and we don't make a space for the positive and finding the good, whether it's within ourselves or it's in others, then we only find the bad, right? So I think as much as we're talking about spaces to take care of ourselves, part of that is also filling our wells with things that are good and good thoughts, and doing that for your peers and students and supervisors.
Caitlin, just out of curiosity, the Clifton Strength Survey, did you guys use that with students as well? Do you guys do any type of inventory in that manner?
So the Clifton Strengths, our hospital actually uses it as a whole, and I don't want to misspeak, but I want to say it does cost money to get the basics, and then to get even, because you get like your top 5 strengths, for example, but then to get your full list where it rates all 33 items, and it would tell you your number 1 through number 33, that's even additional cost. So I know like our hospital didn't give you the full breakdown. They felt like it was just important to have your top 5 and to give you the breakdown of what the top 5 meant for you as an individual employee. That's not something that we offered and that the hospital paid for our students. However, there were things that we suggested our students like look at and take as well, or kind of compare or think about. But our hospital did not pay for them to do that. We offered or said that they're welcome to pay and do it themselves if they wanted to. And I know of students in the past who have just been very curious, especially once they saw what kind of conversations it's led to for our department and how helpful it's been. There's definitely been like a curiosity spike, and well, I want to know this now, right? And I want to know what my strengths are and what that means for me, and maybe how that could even benefit me in an interview, right? So I know of students that have definitely done it and paid for it on their own, because it's not that expensive.
No, that's super interesting. I know that as a supervisor, I've always used like a learning needs assessment for my students, so to kind of understand, how do you learn? How can I support you from a learning standpoint? But I think it's such a that looks at a different aspect. We're looking beyond just their learning needs, but also, into more individualistic qualities that, really could be supported or fostered during an internship. And so you brought that up. It's not something I have considered. So.
Yeah. And like Dee Dee was saying, it's really important to focus on strengths and to have those positive moments in an internship, because it's stressful and it's hard and it's nerve-wracking, right? So if we know their strengths and they know their strengths, we want them to shine and to showcase those, especially when they're doing things like picking their project, right? That's something that they can be thinking about. If my strengths are community building and developing and those kind of things, how can I integrate that into this project so that my strengths shine, I'm still learning and growing, and I'm giving something to this team in this project, right? So I think it's really important to be focusing on strengths, like Dee Dee said.
I just looked it up, and you can do it individually for for $50 and get 34 strings. Otherwise, it is $19 for your top 5.
And I actually, just to add on to that, I actually had a meeting with like our hospital, not within our department, but we have a hospital representative who like leads this and like does the education around strains. And I actually met with them because I was very curious to see my whole list of 33 and like pay that extra money. And he definitely said it wasn't necessary and it wasn't as beneficial as you would think. And that honestly, just doing the $19 one or whatever, $20 one is sufficient and gives you a lot of really good information. But just to be clear, I don't work for Clifton Strains. I don't make any money off of. It's just something that I thought was really helpful for many reasons.
No, absolutely. I think it's great to hear about. So thinking, just kind of, recognizing that we have 5 minutes left. So I appreciate how much you guys are thinking about. So thinking about what are we passing on to the next generation of child life specialists. I mean, we've gotten to hear lots of great things. And so just thinking through, what does this look like? What are we sharing? What are we fostering? What are we teaching, whether purposely or innately? What does that look like? And what are some advice, strategies, or ideas that you guys would share for other supervisors who are here today just to talk and brainstorm and learn? Is there anything, kind of your golden nugget that you would pass along?
Yeah, I think for me, the whole basis of self-care and also, helping or supporting students in being successful is open communication. And I think so much comes with that in terms of, expressing your expectations of that student right from the beginning, while also expressing or asking that student what they need from you to be successful right from the beginning. For me, I think, recognizing that I will have high expectations of that student, but also that I understand that we're all human and that we can offer grace to these students as well in their internship. I think that all comes with open communication. And I think too, one of the things that I often stress to students is that, to always advocate for that quality and for that consistent supervision. I think that space for processing and reflection is so valuable, and it should be something that students and child life specialists alike are getting, and really giving them the permission to feel and ask for help, and let us know when they're feeling burnt out. I think, there's such a heaviness and a vicarious nature to our job, and we're bearing witness to kind of so much sadness and so much heaviness, as well as the joy and the hope. So, I think I would want to pass down that, recognize those signs of burnout, allow yourself to take a break when you need it. And just kind of acknowledge and validate that the work that we do is heavy and emotional and hard, and that that's okay. And I think sometimes just that validation of that and talking about that openly from the beginning can be impactful.
Yeah, I definitely echo that. And also just thinking back to my internship and hearing what the average burnout rate was for child life, and just being floored by that, and hoping that these increased conversations about self-care and about our mental health and the mental health of our students, that we can change that we can extend or we can make this a field that people are in for longer, and that we can really try to improve that for ourselves and for the future child life specialists as well, because I think that we have such a valuable role, but it's just not one that a lot of people can stay in for forever, and that's really sad. And so just figuring out how to support future child life specialists so that can change.
Sophie and Kerry, I agree. I think being open with our students about how difficult this work really is. I think over time, some of us become really good at hiding that, and our students look at us and are like, you make it look so easy. It doesn't seem to bother you. I need to mask what I'm feeling. I need to be strong. having boundaries is not a bad thing. Leaving on time does not mean you're not an overachiever. Setting those expectations and those boundaries from the beginning, and talking to our students about what we are dealing with, even if, like, for example, I go home and my tears and my emotions, they come out in all the wrong places, right? Like the grocery store, the gas station, or you're watching the commercial on TV. So really being authentic with our students and talking about how hard this job really is, because it's very difficult. And from the beginning, you know, helping them understand that this is a journey that you're on. When you finish your internship and start your first job, you're not at the end, you're really at the beginning. And there's no one answer. So it can very much be trial and error. That sustainability really comes with partnership, and no one should have to feel like they're in it alone.
I think to add on, I know I've said the word a few times, but like model. We don't want to just show students the pretty and the fluff, right? We want to show them the real. And I know if I get out of a room and it wasn't the best room I've ever, best intervention I've ever done, or the room felt heavy, or I felt not at best, I would say that, and I would call myself out, or I would just put it out in the open. I would say, oh God, like that room felt yucky, like that didn't seem right, or I'm not on my A game, or I'm still feeling like I'm thinking about the previous room, and sharing those things out loud. And you'd be surprised what the intern or what the student will say back, like, yeah, that didn't feel good, or yeah, that wasn't that great for me. So if you say those things out loud, it gives them the comfort space to also feel those things and say those things, and it helps them recognize that too, because I think ethically that's a part of our role as supervisors, is not just to teach and educate about interventions and how to do X, Y, and Z with the patient or family, but also how to recognize things within ourselves, especially when it comes to self-care and our own mental health, and acknowledging our presence in the room. And I think a part of that is being able to say to our students, like, you know what, I need a break from patient care. I'm going to do some things on the computer. I'm going to work on a project, or I'm going to go check emails, or do something that involves being in an office. I need to ground myself for the next 30 minutes or something. And then when I feel ready, I'm going to go see another patient, because I'm not in the best place right now. And that's okay. We're humans. And I think that is so important to model to our students.
Yes, no, I would agree. And I think that you guys have really spoken to like things that we should be passing down. I think, with student supervision, there is such a need to kind of demonstrate this perfection of like, the career is glorious. It's not that it's not, but we're all human, and we're humans doing a job and a profession that we are all so passionate about. And I think that, having those conversations, and I think there's so much more conversation happening than when I interned 12 years ago. Like it's, we've come a long way, and, for better or worse, I think the last 20 months have taught us a lot. And I think that having that conversation and continuing it, not forgetting that, the goal is that we're all moving, this is going to a better place and a better space, but to not forget that these things are important. And I think that, we've come a long way, and continuing to foster that is so key. So thank you guys all so much for taking the time to join us today. We really, really appreciate it. Thank you to our panelists for participating. Kara, Kerry, Sophie, and Caitlin, thank you. You guys have been invaluable to this. So if anybody has any last minute conversations, we'll hang out for just a second, but we appreciate you guys so much.
And we are doing this every other month, right, Molly? I think that's what we landed on.
So yes, I think our next one, we have not set a date, but we're aiming for November. And then we will pause for the holidays. We recognize that that is busy for everybody personally and professionally.
And we will be sending a follow-up email. I don't think we mentioned that. So Molly and Alice will be sending follow-up emails, and I'll have a survey, and we really like to hear that feedback, and it'll also have your credit in it, right, Molly?
Yeah, so your PD certificate will be sent. And then as Alice stated, if you haven't seen the chat box, we do have a 30-day self-care challenge we'll be sending out as well, just as something as a reminder. So we appreciate you guys. Take care of yourselves and your students. All right, thank you guys.
Thank you so much.
Thank you.